Hello, everyone, and thank you so much for coming out here today. My name is Sonia Boger, and I am a senior at South Salem High School. I would personally like to thank the Salem chapter of Democratic Socialist of America, Healthcare for All of Oregon, and Mid-Valley Healthcare Associates for spreading the word and helping contribute to this event. I would also like to give a special shout out to Larry McCool, Ariel Knox, and the famous Caesar the No Drama Llama. I would also like to thank our awesome volunteers for helping organize and set up this whole setup today. Okay. So this event was organized by my incredible colleagues and I from South Salem High School's Progressive Activism Club. We founded this club this year to give youth a voice and empower them. A Medicare for All policy is something that many of us feel strongly about because a loved one or ourselves has struggled with paying for medical checkups or procedures. Personally, this issue is important to me because I have had 5 leg surgeries and 1 neck surgery to treat my rare bone condition, X-linked hypophosphatemia. Going through that was emotionally straining on me as a child. However, I've been fortunate enough to receive care through my health insurance and the non-profit organizations Shriners and Dornbecker's Children's Hospital. I cannot begin to imagine what it would be like to not be able to have these surgeries that have effectively made me an able-bodied person. Without further ado, I would like to introduce our first speaker, Deb Patterson. Deb Patterson has more than 20 years of experience in health advocacy and education. She was a team leader of the Deaconess Incarnate World Healthcare System.
Morning, and Sonia, thank you so much for organizing this, and thank you to all your team. Thank you to all who are here in the rain. Come a long way. The days when a hospital stay for a week required you to put down a $5 deposit. At the end of the week, you'd get back what hadn't been spent out of the $5 bill. We've come a long day from when nuns in Wisconsin helped loggers by offering one of the first group plans to pay for the care of those who are sick or hurt. Those socialist nuns. We've come a long way from when hospitals were houses supported by church ladies who made soup and sewed curtains. When there was no antibiotic-resistant bacteria because there weren't any antibiotics. When ether was your anesthesia, and most surgeries were amputations. Come a long way from World War II when employers couldn't give raises, so they offered something called health insurance as a benefit to keep workers. Today we have IVs, CTs, MRIs, and an alphabet soup of medical advances. We have skyrocketing costs with the health insurance industry making a fortune off us. 18% of our GDP is spent on healthcare, more than any other nation. What do we get for that spending? We have the lowest life expectancy and the highest infant mortality among the top 10 high-income nations. Friends, as a retired healthcare administrator, I'm here to tell you that this is fiscally irresponsible and unacceptable, which you already knew. And as a clergywoman, I'm here to tell you, and you already know this too, that this is morally unacceptable as well. Our costs, by the way, Jesus said, preach, teach, and heal in my faith tradition, not preach, teach, and steal.
Hear, hear.
Our costs keep going up. We can't afford to pay more. A According to a Federal Reserve 2017 economic report, nearly half of Americans have less than $400 in savings. Medical debt contributes to 2/3 of all bankruptcies in this country still today. For those with good health coverage, you can get great care here like you can in other countries. But for those without insurance, health care is delayed, often, or foregone. A study published in the American Journal of Public Health estimates that for the nearly 30 million uninsured individuals in the U.S., lack of coverage leads to about 45,000 deaths every year. That's the equivalent to the death toll on 9/11, nearly 10 times over every year. Today, many small businesses can't afford to provide health insurance. Larger employers can provide it, but some plans lack important benefits such as cancer care. It's time to untangle health insurance from employment, which is exactly what happens when you retire and you go on Medicare. It's time to be fiscally responsible, providing comprehensive quality health care for all, at less cost. Medicare for all is a way to get there that has growing support. To be sure, there are other ways. The German model of regulating health insurance companies, which are non-profit organizations there, and heaven help us if we don't just focus on the goal. Healthcare for all, healthcare for all, healthcare for all. If we don't, we'll be set up to fight among ourselves and shoot at each other in a circle and end up with nothing more than we have today. In this, I agree with Dr. Andrew Shute, who is not the biggest fan of Medicare for all, but who says, morally, it's a great failure that lack of insurance coverage and high prices restrict so many Americans' access to health care. Medicare for all, he says, brings equity to the system through universal coverage and the elimination of medical bankruptcy. Let's fight for universal access to health care through shared public cost. Let's invest in our economy in ways that are savvy and sustainable. When we uncouple health insurance from employment, employers can raise wages, industries can be more competitive internationally when they don't have to shoulder the burden for health insurance. Some say we can't change because it'll impact jobs. But why should such a large percentage of my health care premiums and yours, about 20%, be used to pay for jobs that provide no health care services? I'd rather pay to retrain those working in the insurance industry to become doctors, nurses, home care workers, social workers, and more. We're going to need them with our aging population. Did we stay with horses and buggies to keep the blacksmiths employed? Did we stay with elevator operators and telephone operators, or did they learn to do something else? Let's streamline the system and get our money's worth as we take care of our families and our neighbors. It's a moral imperative that we act for the good of all. Accessible, affordable quality health care for some or for all?
Yeah.
When do we want it?
Now.
Health